All right, so good morning. My name's Mary Pickner. I am the substance misuse prevention consultant for Franklin and Grand Isle County. Welcome everybody. And Melinda is on holiday, although she hopped on this morning to get me into this. We'll have to work on that. But we always start with our introductions and our gratitude, and I, if that's okay with you, will just start up there and in the order that I see you in. So good morning, Tracy.
Good morning. My name is Tracy Thomason, and I'm the Director of Operations for Savita. I cover Vermont and New Hampshire. I'm having all sorts of computer issues today, but I am grateful for last week at the summit. It was such a wonderful time. That was my first time. And so I'm grateful to meet people I haven't met before, to see people I have seen, and to have such a great turnout with my staff supporting Savita. And I'm grateful that it looks like it's going to be another beautiful day, and I have my grandson and my stepdaughter here, so I'm excited about that.
That sounds like a fantastic day. Thank you. I have 901 Pinar. I'm not sure if you would like me to change that, or are we good with that? But introduce yourself and something you're grateful for.
Good morning. I'm Lori Pinard, and I am a community nutrition educator with UVM Extension. And I'm very glad to be here and to see so many people attending. In a nutshell, for those of you who are not aware of the Community Nutrition Education Program, I teach nutrition and cooking skills to folks who have limited resources, and I do that in a series so that we can look at possible behavior changes over the course of time. And right now I'm the only one, so I cover all of Vermont.
Oh, excellent. Excellent. In control of the whole state. Is this your first meeting of our partnership meeting?
Probably in a long time. I'm usually out in the community, so I haven't been able to attend much in the way of hanging out with folks, which is a shame. So I'm very thankful I'm here this morning and get to see some great people and hear some good stuff.
Well, welcome back. But let us know if it's your first time or coming back. I love that. Welcome back. Not in CBSS. Brendan McCormick. From Sana. I don't know if you're muted. I can't see that far.
Did he? There was one that said that they were on listening only.
Oh, I don't know. Let's find out.
Yes.
Yes, I'll just be listening in today. So, yes.
Brendan is in listen only mode.
Yes, but he is grateful to be here as always. Thank you. Christine Porcaro, now is the time. Come on in.
Hi, I'm Christine Porcaro. I'm with the Healthy Roots Collaborative, or Food Systems Program in Franklin and Grand Isle. I think Peter, who does our Gleaning and Farm to School, gave a presentation last year at this meeting. But I am grateful, actually, in the gleaning world, it's blueberry season, and we've been doing a lot of blueberry gleanings. So it's really awesome to be getting fresh local fruit into the community. So something that has been really awesome and exciting.
Fantastic, thank you. I happen to love blueberries too. Jess Graff.
Good morning, everyone. I'm Jess Graff. I'm the Director of Franklin Grand Isle Community Action, which is a program of CVOEO, the Champlain Valley Office of Economic Opportunity. And this morning I'm trying really hard to be grateful for men's underwear. We picked up a pallet of men's underwear from Walmart charitable donations yesterday. I'm pretty sure I have enough men's underwear to give a pair to every single man in Franklin County at this point. If anyone has any creative ideas on like art installations one could do with men's underwear, that would be great. Just put it in the chat. Thank you so much.
Nice. When I was younger, they were always hung on the flagpole to embarrass whoever was, I don't know. Yes, it was a very active and fun household, but yes, flagpole's great. Laura Need.
Hi, I'm Laura Need with A12. I am the Nutrition and Wellness Coordinator for Franklin and Grand Isle counties. And this is my first meeting. Michelle invited me, so I figured I'd jump on. Thanks, Michelle.
Welcome.
And I am grateful for just some sunshine today. I'll take every little bit I can get.
Fantastic, welcome. Welcome to your first time. Usually we ask you to do some sort of interpretive dance, but nice crowd.
Okay, I tell my clients I can't dance, they drag me up on the dance floor and you don't wanna see it. It's like the Elaine from Seinfeld, yeah.
Oh, nice, good picture there, good picture. All right, Lori from ADO/Indio Director. Are you there? Lori? I don't know.
Lori did put a message in the chat a
Thank
couple
you.
minutes ago that said that she had to hop off for a few.
Okay, perfect. Maybe we'll get her at the end. Thank you so much. It's a lot. My list of people gets small when I add the messages. Lex, come on in.
Good morning, everyone. My name is Lex Arthurs. I am the Community Relations Manager for Vermont Foundation of Recovery, V4. Here in Vermont, we have a network of 9, very, very, very soon to be 10 sober homes across the state of Vermont. We are getting so very close to having all of our Essex locations fully updated and adding an additional home there. So we're really, really excited about that. And that is what I am grateful for today. We got to walk through some of the Essex properties yesterday with Jeff from VTAR for our annual recertification, which we always love doing. And it was so wonderful to see the renovations and see how close we are to being done in that area and adding 10 extra beds.
Cool. That is fantastic. Oh, that is exciting. Thank you. We'll have to, so hopefully next month you can say, ta-da, they have opened their doors. I would love that. Megan.
Good morning, everyone. Megan Bridges, Director of Partner Funding and Volunteer Engagement at United Way of Northwest Vermont. And I am very grateful for summer and spending time with friends and family and blueberry season as well. So good morning, everyone.
Good morning. Yeah, I tried growing blueberries. It's a very sad affair. I get like 1, 2. Nye. And if I said it wrong, correct me.
My name is Nye Amkowski. I am the Family Services Coordinator for Agreement on Habitat for Humanity. We are operating in Northwestern Vermont. We're currently building in St. Albans, so I'm grateful to be giving a family a home soon in St. Albans, hopefully. This is my first time here. Megan invited me, so thank you, Megan, and thank you all for having me.
Welcome, welcome. Thank you for being here. Something you're grateful for?
Like everyone's saying, I'm grateful for the sun. I'm grateful for the summer. Being in New England, I relish every minute of it. So yeah.
I agree. Thank you and welcome. I'm glad you're here today. Peter.
Right, good morning, everyone. Great to see everybody after a wonderful summit. My name is Peter Anders. I work for Adult and Teen Challenge. I work for the End Addiction Team, Church Services and Public Relations. I am very grateful to say that our admissions numbers are going up. which means people are seeking the help they need to recover. So beds are getting full, and that's a great problem. I mean, ideally, I'd like to work myself out of a job, but right now it's just getting people healthy. So great to be here, great to see everybody. And if anybody wants to give away underwear, we got about 25 guys that could use some, so let me know.
Ooh, Jess, connection, look at that. She's like, come on in, come on over, yeah. Oh my gosh, I would laugh if they're all only one size, so. Yikes, hopefully they're not.
They're not. We're located at 5 Munda Drive in St. Albans. Please come down and I will help you pack a box full of underwear into your car.
Mm. And if it's, you know, she might be able to, you know the building because it is decorated instead of with Christmas lights, it would be underwear.
Decorated with men's underwear.
Yes. Randy, come on in. See, one connection.
Good morning, everybody. I'm Randy Allen. I'm a recovery coach, Turning Point in Franklin County. Today, I am grateful for my 4 grandkids. I got to spend the afternoon with 2 of them yesterday with a pizza party, and took our RC cars and went to the park and raced them around and crashed them. And
Cool.
that was with my 6-year-old grandson. And I'm just grateful that they're in my life.
Wonderful. It is true. I don't have any of those yet. Not ready yet.
No.
Getting close. Samantha?
Hi, I'm Samantha Zellinger. I am one of the 4 DV specialists for DCF, and I cover St. John's, Very Newport, and St. Albans area. Zoom does not like me, so my camera is not functioning properly, so you'll get the black screen. And like other people have said, I'm just really grateful for the sun because I am perpetually cold.
Mm. It's interesting. A lot of people who live in New England are perpetually closed. And is this your first time?
Yes, it is. Melinda invited me.
Welcome, welcome, welcome.
Reminder for those of you that are first time, if you would put in the chat your email address and make sure you got your full name so that we can get you on the list, so we get you on the listserv. So.
That would be great.
Yeah.
I'm gonna go buzz back to Lori. Are you back yet? Yes.
Hi, I'm here. I'm Lori Pion. I am the district director for economic services, and I oversee Newport area and St. Albans areas. Something I'm grateful for. A lot of people already said that, but blueberries. I went and picked them last night, so I have fresh blueberries for breakfast this morning.
Ooh, fantastic. I need to go pick some blueberries. I picked 2, but fantastic. Welcome, welcome, welcome. Thank you for being here. Did I miss anybody online? I think I got them all. Miracle of miracles. All right, so let's go around the room. How about we start over here?
I will start. My name is Kathleen Shadow. I am the rector at Holy Trinity Episcopal Church in Swanton, and I've been here almost a year, which is one of the things I'm very grateful for. I'm grateful for the sun, but I am very much not a hot weather person, so I am probably more thankful for the fact that it is cooler. So cooler and the sun makes me a very, very happy person.
Me too. I agree. I agree. Michelle, come on.
Hi, good morning, everyone. I'm Michelle Trea, Northwestern Counseling and Support Services Parent-Child Center. I'm the Family Access Coordinator. I too am thankful for the blueberries. They're really good this year. But I'm also very thankful in the last months for the VA and for Age-Well, who have really put some things into place to help my parents so my dad can be better taken care of and their house can be better accessible to him.
Fantastic. That is wonderful news. And I'm sure relief too. Like
it's
yes.
Well, mom's stress level has gone down with some of the supports put in place. So
yes. Oh, fantastic. That's how it works. Ivy?
Hi everyone, I'm Ivy. I'm from Hunger Free Vermont. I'm the Director of Policy and Advocacy. This is my first meeting. I'm really glad to be here. And yeah, thank you very much. Usually most of my days are spent jumping from Zoom meeting to Zoom meeting to Zoom meeting, so I'm really grateful to be in the community today. I have a bunch of in-person meetings across northern Vermont, so I'm just very glad to be in person with fellow people.
Well, welcome, I'm so glad you're here. Finally to put a face to a name.
Emailing to
Yes.
face.
Yes. Ivy sends out a lot of emails and earlier I was like, I don't know, I know that name from somewhere. But it's always when I'm going through them, I'm like, Ivy Enoch, which is a great name and a great ring. So I actually read them because I read it. So you can't change your name otherwise.
I don't plan on.
Yeah. Erin.
Yeah, hi folks. I'm Erin Creeley. I'm the district director for the St. Albans Office of Local Health, part of Vermont Department of Health. And I am also grateful for the cool temps, the sunshine, even maybe a little bit grateful for noticing that the time is changing, the sun is changing. I feel mixed, it's a mixed blessing, but yeah, it's a constancy, so I'm grateful for that.
Super, thank you. Good to see you in person. Ken.
I'm Ken Hammond. I'm a Field Services Director with Agency of Human Services.
Hi.
Yes, hi. And Kristen Pryor's moved to Economic Services, and I've been in Barrie and Hartford as a Field Services Director, but I'm switching over to here because it's a lot closer. And so what I'm thankful for is Route 104 because it was like 25 minutes and I don't think there was any frost heaves or potholes or
Today.
Versus an hour and a half on 89
Yeah.
with like 9 construction zones.
Yes. And first time here.
First time here. No dancing. I will not dance.
Yes. And it's wonderful that we are not waiting. I work in state government, so if this position had to be posted and filled, it could be next spring easily. So I'm glad you're transferring over. So, and we'll add you to the list. We just need your email and IVs too. But
I got this somehow. Did someone forward it or was I on?
Maybe.
Can I just write your email on this thing?
Yeah. Okay. Right. On the piece of paper that we all look at. So. Welcome. And Michelle.
Good morning, everyone. My name is Michelle Bissett. I am the Advocate Outreach Coordinator at the Abenaki Nation oh my gosh, I can't even talk. At the Abenaki Nation of Missisquoi, I do domestic sexual violence there.
Welcome. Good to see you. Drive in. John.
And now it's me, John Gordon.
Oh, wait. I'm sorry.
What are you thankful for?
My grandkids and my family, they make my life really great.
Yeah, that's so true. It's sort of like grandkids and family and like, that's it, it's perfect.
Slide that down.
Yeah, oh, we'll get it, thank you. All right, John.
All right, John Gordon, Sheldon Methodist Church Food Shelf. And I've got a couple of other things. On a personal level, my wife and I just celebrated our 54th wedding anniversary on the 20th of June.
Wow.
And then on the 22nd of June, I went with several of my grandkids and we went over to Santa's Village. And I got a chance to get the picture with my hair and it's going down the log flume. And I don't know if people talked about the weather. I don't know if anybody's noticed, but the last couple of nights, the moon has been bright orange, beautiful bright orange out. And those of you this year, for the first time, my food shelf became a distributor of the summer meals boxes. We've had 7 distributions. There are 2 more to go. As of last Friday, I have distributed 1,319 meal boxes to children. And all the families that come also get a whole selection. We have them come in the food shelf and take a whole selection of fresh produce. So I have moved a boatload of fresh produce over the last few weeks too.
Fantastic. And what are you grateful for?
All of that.
All of that. This is true. This is true.
Yeah. Hey everyone, Danny Roberts. I'm the Director of Northwestern Counseling and Support Services. I am grateful for an event that I went to last month, which was actually with the Abenaki Nations of Missisquoi, and I went to Brunswick, Vermont, which I think had 121 people living there, but this was where there's 110 acres that has been with the Abenaki forever, and it was just, one, it was something that I didn't realize I really needed. I got to learn a lot just about their culture, and one of my biggest takeaways that Chief Gagne said was, and again, like this land's been with them for generations, was we don't own the land owns us, and it's actually one of the 8 natural wonders, and there's a lot of things online about it. So if you get a chance, Google Brunswick Springs and there's some pretty cool stories with it, but that was just an experience I was really grateful for. So again, thank you, Michelle, for letting us go. And for me, I think community, and what I love about this group is, you know, we're coming from all these different organizations, but the biggest thing is connections and community, and I think that's what a lot of people need. And I mean, on the bus ride home, you know, people are offering us like, hey, we'll give you some recipes, you know, do you need this? And they were just so welcoming. So, you know, shout out to Michelle and your group, but also check them out on Facebook. There's so many events that everyone is welcome to attend, and I was just really grateful for that experience. And I got to bring my nephew and my mom, so it was a nice time.
That's wonderful.
Yeah, it was.
Super. And my name's Mary Pickner. I'm the Substance Misuse Prevention Consultant for the Division of Substance Use Programs at the Vermont Department of Health. Amy Brewer is not here today because she's the only person with a longer name, you know, title than mine. And you know, I'm incredibly grateful that I can be of service and to be of help, right? I think, you know, as a person in long-term recovery, and I'm not in my 20s anymore, one of the things I think about is that I think when I was younger, I always wanted to push to be important and have like this mark in the world and all of this stuff. And today I'm just really grateful to be of help rather than, you know, I don't know, be the top dog in something. So just really appreciate that change of mind. And it's been like that for a while, but as I get more accepting, and I just, you know, it just makes my life so much easier and right exactly where I want to be. So,
I am not thankful for blueberries. I have so many, I have fresh blueberries and frozen blueberries, I can't give them away fast enough.
I don't need to be at the food shelf. I just went out.
The frozen ones aren't bad, you know, because at least I can keep them stored. The fresh blueberries, trying to get them out the door fast enough has been a challenge, because they have been plentiful this year.
We can talk. I know, and we're still gleaning them according to Christine. So more to come. All right, so maybe we should print up some lovely blueberry recipes. All right, what's next? I forgot.
Just an approval of the meeting notes.
Yes, the meeting minutes, we need somebody to approve them, and then
To
somebody
make
to
a
second.
motion, yeah.
Make a motion and then second them.
Second.
I'll make a motion.
Okay, Michelle.
Michelle will make a motion, and
Michelle
Michelle
Michelle.
also second it. Perfect.
All those in favor?
All those in favor?
Aye.
Ayes.
Opposed?
Any opposing or abstainings? 1, 2, 3. Okay, wonderful. And then, okay, as you know, I'm not, Melinda, but so now, but you get, the people in the room already know that I don't have the agenda because I deleted it. So, it's, you know, small problem. So this morning we have 2 folks coming in to talk about the Food Security Network. We have Michelle Trea and Ivy Enoch, and I would love to give them a lovely warm welcome. And I have to record this now, right?
Yes.
Where do I do that? Record. All right. Let me get this organized. Record to cloud, record to this computer. What do you think?
I would record to your computer then.
Yes, because I don't even know where it is. The cloud is somewhere. All right, sharing is not turned on.
Okay, yeah, there you go.
Allow.
You allow that?
Does that help? Yes.
They should have gotten a message that said recording. Look at the recording.
No, I haven't touched it yet. I figured I'd wait till
Okay.
the moment.
Because everybody should get a message to say.
Okay. I have a different view. Is that okay?
Can everyone see that okay?
So is it okay that I record it like this?
Yeah, that's fine. Can
Okay.
you ask if everyone can see it on Zoom?
Yeah. Can you see the full screen on Zoom?
Yeah, we see it.
Okay, super. All right, so I'm going to record to this computer.
Recording in progress.
Take it away. Thank you.
Well, thank you all for having us. So as we've introduced ourselves earlier, I'm Michelle Trea. I do work at NCSS, but I'm here in my role as a community co-chair of the Food Security Network of Franklin and Grand Isle. And we'll talk a little bit more about what the food security networks are, but Hunger Free Vermont is the backbone organization for the 10 food security networks of Vermont, and I have the true honor and delight of being the staffer for the Franklin Grand Isle Food Security Network. Yeah, so you may have known this network under its former name, the Hunger Councils of Vermont. We changed the name this year to the Food Security Networks of Vermont for a number of different reasons, primarily to really center what we want for everyone in Vermont, which is food security, not hunger. And as I mentioned, Hunger Free Vermont is the backbone organization for the 10 food security networks of Vermont. Those started about 20 years ago, and they have just continued to grow and strengthen over time. And the why, why do these food security networks exist? The end goal is not hunger, it's food security. So the name really needed to reflect that. But one of the primary goals of the food security networks is to convene folks local in their own communities to come together to discuss the issue of hunger and solutions to ensure food security for all. You all in your communities and everyone in their own communities are experts in the resources available and the solutions to folks in your own communities. So we have 10 regional food security networks. Hunger Free Vermont, as I've said, is the convening organizer. So we support our amazing co-chairs. Each food security network has 2 co-chairs who really lead those quarterly meetings and make sure that the conversations and topics brought to those meetings are relevant and central to the needs and what's happening in community. And each food security network collaborates to share information, raise awareness about the root causes of hunger and what the solutions are, brainstorm solutions, and build partnerships. And the work happens even between meetings. And every food security network has a bit of a different flavor because no community is the same in Vermont. And I'll just say I'm a little bit biased, but the Franklin Grand Isle Food Security Network is one of the tightest knit food security networks in the state, which I think is a real testament to the connections you all have made and already have in many different spaces in the counties. So who's the leadership? As I mentioned, there are 2 co-chairs. Michelle is one of the co-chairs, and Christine on Zoom is our other co-chair. They are incredible leaders of this food security network. They make my job as staffing the food security network incredibly easy. And they have been chairs for 4 years, 3 years? 3 years, I think.
Several years. Really, I think have done such an incredible job of bringing more folks to this network, expanding the conversations, and again, really centering the solutions to hunger. So hats off to Michelle and Christine.
Well, and hats off to Ivy as our staffer also. So who makes up this network in our region? Well, it's just not food shelves. I think sometimes that people think, oh, it's food security, so we have to have food shelves. It's a variety of organizations, just like this partnership, that represent people through the lifespan from early childhood all the way up through elder. So we have organizations that are present from the healthcare field, from housing, from community supports, and from the food shelves. So how do we refer to food insecurity in our conversations? Well, we call it what it is. We talk about the fact that people are hungry, not food insecure. This was actually adopted from Senator Rosa DeLauro from Connecticut, who, if anyone has not seen her speak, she's very fiery and passionate. It's what she said in one of the White House conferences and how she asked her colleagues to address it. Food security is what reflects the data points Hunger is what reflects the people. If you do not have enough access to food, then you are hungry. And right now, 2 in 5 people are experiencing hunger in Vermont. So why are we here? Well, as part of a strategy around community awareness, the Food Security Network wanted to bring the stories and the data of what we're seeing out to as many people as will listen to us. And the community partnership obviously is also a very tight-knit group with lots of folks in the community, so it was the right fit to come. Because we really want people to understand the realm of what has been seen and what is being seen, and share some of the things we talk about as strategies. So what is being seen by the Food Security Network members? The number of households visiting the area food shelves is increasing. The number of first-time households that are having to access food is increasing. At the same time that monetary donations, the amount of donated rescued food and grant opportunities are decreasing across organizations. We have quite a few members of the network that have had grants cut and those sorts of pieces. And statewide, there's been a wholesale reduction in grants, including $1.8 million for schools, child cares, and food shelves to access local foods. That's a lot of money. What we're also seeing that's being reported by the network members is the wait list for homeless shelters are increasing, along with the number of truly unhoused people. And we're also seeing across organizations the number of people that needing utility support and underfunding supports is also increasing. As we reflect on what is being seen, the other thing that we really thought important, Ivy, Christine, and I, to note, is that if we look at the food shelves, the majority of people that are running these food shelves are volunteers. So they are donating their time to run the food shelves when they're seeing an all-time high. So they're putting in long hours, and in many cases, they're lifting hundreds of pounds of food a week. And they're doing work that can be very emotionally draining. That's why last month at the Food Security Network meeting, we took the time to do a whole segment on compassion fatigue, because we want people to take care of themselves. This work is draining. We also think it's important, before we look at this data, to put it basically in the basic need access and perspective with the greater system of care. Probably don't have to review with this group Maslow's hierarchy of needs. The baseline is access to basic needs. So many people in this partnership, we ask people to do higher level skills thinking, whether it's physical health, mental health, substance abuse, anything. And sometimes even just daily living skills such as parenting. It takes a lot of energy, right? And if you don't have access to basic needs, your energy is probably spent on accessing that. So that's why this is so important. So let's look at some of the data. Before we look at that, I will point out that this data that is from May, from when I was starting to put the PowerPoint together for this, and the numbers have increased since then. So I got some data from the Missisquoi Abenaki Nation, and the chief let me know that in May they served 573 households. The numbers are increasing for their first-time households. They've had to adjust the visits to one time a month and scaling down the box sizes. And a sobering statistic that was provided by Debbie from there when she was looking at the grant reports is in 2024, they served over 8,000 individual underduplicated people. So I verified that number 3 times because it seemed like, wow, that's a lot of people, but that's what they served. And then we have John and the Sheldon crew. In May, they served 270 unduplicated households, which was almost 800 people. And as he already said, in June, they started the distribution for the summer meals program where they're giving out over 200 boxes a week to kids so that they can eat this summer while school's out. And the other thing that should be noted for Sheldon is in 2025, they also started handing out the USDA commodities boxes to people over 60 who are income qualified, and they're giving out over 70 boxes a month, which is an additional like 40 pounds of food for these folks to be able to have to eat. The numbers from Danielle at Northwest Family Foods, which is at Community Action here in St. Albans, is in May. They had served 465 households, again, almost 800 people. And they had, for May, 56 first-time households, which was on par from the previous months. Their usage was actually flat from April, but she wanted to make sure that she noted that in January, February, and March of this year, they saw a double-digit increase in the percent of people coming. And then we have our Champlain Islands food shelf. In 2020, they were serving 20 households a week, and now they're serving over 50. So more than doubled. Age Well is also a part of this amazing group, and they serve Addison, Chittenden, Grand Isle, and Franklin counties. And so the Meals on Wheels numbers were in 2024, or since 10/1/2024, where Meals on Wheels were over 184,000, almost 6,400 grab and go meals, and almost 22,000 congregate meals at their different sites. I think the other thing important to share from Age Well is that a statistic from 2024 is for their programs, they do a statewide agency on aging screening tool. And in 2024, 49% of the people they screened, so almost half, scored at medium to high risk for food insecurity. So we're not talking low. So even with the programs that they're offering, there is still a lot of need for additional food for these folks. Then we have our fabulous Martha's Kitchen and Brother Bob and his amazing staff of volunteers. In 2000, they served 9,101 meals, and now in 2024, it was over 58,000 meals. So that's, again, staggering, thinking about the amount of work that needs to be done, amount of food that has to be gathered, plus the need for monetary donations. And then numbers from Ben over at the Champlain Valley Office of Economic Opportunity, the Samaritan House program. Last fiscal year, they had 83 individuals in shelter for a total of almost 7,000 nights. 22 of those guests, so 32%, were actually exited shelter into permanent housing. The other thing that we really need to know is 36 of the guests self-reported a mental health disorder and 39 reported a substance abuse disorder. And 43 were considered chronically homeless. So again, things to know as they're working with people on housing. There's so many other service needs that folks are coming with that they need to sort out with the help of staff. I thought it was also important to put in a wish list for Community Action and Samaritan House, and also for Community Action, Jess and crew. For big needs, it's always camping supplies. Tents, sleeping bags, bug spray, all of the stuff that we need for camping. As they're having folks come to them that are unhoused, or as they're exiting the programs, they do hope to give them something to help if they have to truly be outside, and unfortunately sometimes they've not been able to do that because they haven't had the gear. So it's something for us as a community to know, so we can support our fellow folks. They also go through a ton of cleaning supplies and hygiene supplies at the Samaritan House, and their drop-in center had over 2,000 visits last year. So they go through a ton of coffee, laundry pods, and non-perishable snacks and easy meals. So think Chef Boyardee, people, and help Ben and crew out. So those are some of the data as far as the folks that are directly doing that work, but there are also many other regional programs that are helping with other further education and other basic needs access, so we wanted to put that in here as well. Well, there's us, Northwestern Counseling and Support Services Parent-Child Center. I started my position in October 2024, and through June 2025, I, with the help of the VNA of Southwestern Vermont, 15 regional libraries, distributed over 31,000 diapers in Franklin and Grand Isle County. So that's why my arms have been very tired. And not to mention wipes to go with those diapers. I didn't count those up. We also distributed pull-ups. We have a Crib for Kids program because we're finding there's a lot of babies that are sleeping in very unsafe ways, and so we work around that, particularly looking at Erin, and we work particularly with Heather Simpkins and the VNA around making sure kids are sleeping in a safe place, and we also have formula, so when the WIC runs out, people can call us for formula. We supported families with other concrete supports, such as access to one-time gift cards, support with one-time funding, and car seat assistance stations, and not to mention just brainstorming of resources. Christine and Peter at the Healthy Roots Collaborative, which is a program of CVOEO. In 2024, they gleaned over 52,000 pounds of produce. They have 34 recipient sites with 21 receiving regular deliveries. They have 20 CSA boxes that are packed and delivered through their two food box programs. One's Northwest Pharmacy CSA, and the other is the Migrant Household Food Program. And this accounted for over $17,000 in local food purchasing, which is important. They have 18 farms and food partners they added new food partners last year. So another big partner in this all is the Notch and all of their federally qualified sites. So as I just mentioned, they have the produce prescription program, which they partner with Healthy Roots on, to offer a seasonal produce prescription program for eligible patients, where they receive fresh fruits and vegetables delivered right to their homes. They also do nutrition education by offering cooking and nutrition education classes at Richford and other community sites. In all of their waiting rooms, they have a pantry of fresh produce available, which is very helpful. And they also have the nifty, thrifty thrift shop in Richford, which they always like to remind folks, anyone in this room, if you are working with a family and there's an emergency need and they need stuff, to reach out to the Notch because they will help get you the stuff at no cost. So. I just put some quotes in from the Healthy Roots partnership with the Notch Pharmacy. Grateful for this program. I was able to pay more bills. The Northwest Pharmacy CSA provided healthy food when I couldn't. Thank you. That's from the participant. And from Holly Baldwin, who is the owner at West Farm, the Northwest Pharmacy CSA and Migrant Household Food Box Program complements our production system by way of the crops we're growing, and the program is also aligned with the mission that fresh and nutritious food is available to those who need it in our direct community. The other thing that the Notch is doing that many of us know about is that they have the Main Street Market in Richford, which is actually the first nonprofit grocery store in Vermont to be owned and operated by a health center. So they're able to incorporate other aspects in around it being a social grocery store. So community partner programs, shopping with the WIC and SNAP, local farm direct produce, nutrition and shopper education, and then healthy store-made grab-and-go meals for folks to get. And as Lori, who was introducing herself earlier, had said, there's also community nutrition education programs that she works on, again, over a course of time with participating folks with the University of Vermont Extension to helpfully help folks with nutrition and cooking education. And so here are some of the programs listed: the Expanded Food and Nutrition Program and SNAP Education. summit participants and the work that they're doing. Other community agencies, and again, I didn't leave anyone out of either of these two things because I was like, wow, there's too many. We would be here for weeks, folks, if I listed everyone and all the data. So I just tried to do a snapshot. Obviously, we have Community Action of Franklin Grand Isle, and we also have Lori's House here in. We have the Welcome Home Initiative between Community Action, Sheldon Food Shelf, and First Congregational Church, which was born during networking of this very own partnership, so yay. And they help get stuff for folks that are exiting homelessness and going into an apartment. They help get them stuff to get set up because a lot of times you just don't have nothing, so you need a mop and a broom and some food and that fun stuff. We have to make sure that we honor our regional churches. They are doing so much. I mean, Reverend is here. She's so the Holy Trinity Episcopal Church, who I got the pleasure of meeting with the other week, has volunteers handing out diapers, wipes, pull-ups, Depends, and hygiene supplies, thanks to their generous donors. And then many churches have one available donated funds to help with bills and groceries as well. So they are just extremely amazing partners in all of the work that we're doing as we're trying to find resources for families. And so many others, including, Erin and her crew at the Vermont Department of Health and the WIC clinics. Again, trying to get people connected. And the lead organization that's getting all of the food across the state is the Vermont Food Bank. In 2024, they distributed over 14.5 million pounds of food to its statewide network partners. Of that, over 4.5 million was fresh produce. And the thing that we need to understand about the Vermont Food Bank is that they are able to get a better buying power than any of us in this room to be able to get food to distribute. But the other thing that we should know is the Vermont Food Bank is facing its own challenges. The need for food is at an all-time high, which equates to the need for more dollars to buy food. The Vermont Food Bank is also working to protect its network partners, which there are hundreds of, from tariffs on food like produce they source from Vermont's neighbor, Canada. It's quite a bit of the produce comes from our neighbor, right there. And in spring of 2025, it was informed that they would be losing roughly 20% of their USDA federal food stock for the year. So those are some of the challenges facing them. Your turn.
Yeah, this is, I know, information that we all know. It's still really heavy to hold. I think it's important to really talk about the fact that hunger happens when folks can't meet all of their basic needs at once. It is not an individual failure. It's not a community failure. It's a systemic issue. And so I'm going to be talking about our state and federal advocacy, what we have on the horizon, and what we are trying to respond to at the federal level. And I think it's also important to acknowledge that the food security networks of Vermont really help inform Hunger Free Vermont's state and federal advocacy. So we really depend on the ground information, experiences, what's happening in Vermont, so we can think about and strategize not only with state policymakers but our federal congressional delegation about long-term policy solutions to be sure everyone in Vermont has the food security that they deserve. So we can go to the next slide. So this is not news to any of us at this point, but last month Congress passed H.R. 1, which I'm calling the very harmful mega bill. It included a number of federal eligibility changes and funding cuts to really essential programs like SNAP and Medicaid and other programs as well. And these changes have different effective dates, different implementation dates over the next few years. So we can go to the next slide. the changes to SNAP occurred, I will just say. It was the largest cut to the program in the history of the program, really unprecedented funding cuts, changes to the funding structure, and eligibility changes that will have a really harmful impact on every community in Vermont. About 10% of our state population participate in SNAP. That's not even close to the number of folks who are actually eligible for the program. What was changed about SNAP in HR 1? Changes to state administrative costs. So for the history of the program, state agencies and the federal government have split the cost of actually administering the program and operating the program 50-50. This changes that structure, so the state will now have to contribute 75% of the cost to administer and operate SNAP, which will be about an $8 million increase in the expenses annually for Vermont. It also restricts the calculation that actually is behind the monthly benefit amounts that folks get every month. So it freezes that calculation in place, which year over year will result in benefit inadequacy. We also, so those were kind of the funding cuts, and now we're transitioning into eligibility changes. So there were changes to what we know as the work reporting requirements for SNAP. I like to say these are really paperwork requirements, not actually work requirements. Most folks who can work do work, and work reporting requirements just result in more burdensome paperwork for folks who are accessing the grocery support they need, and it's also more paperwork and administrative burden for our state. But this law expands who has to report work activity in order to maintain their SNAP benefits. So it will include older adults up to 65, families with kids 14 and up. It also includes veterans, folks experiencing homelessness, and folks aging out of foster care. So this will have a big impact on Vermonters who depend on SNAP. It also changes access to SNAP for many immigrants in the US and here in Vermont. This will impact about 1,600 of our immigrant community members. And what it does is it completely bars access to SNAP for people who are refugees, humanitarian asylees, or in the US on some other immigrant statuses. This is one of the most immediate and most damaging impacts to the harmful MECL bill. And then finally, essentially there was a change in how and what folks can report in monthly expenses. Monthly expenses go into the calculation of what folks get in SNAP benefits every month. So fewer people will qualify to receive a utility deduction, which lowers their monthly income and increases their monthly benefit. So this will reduce the monthly benefit amount that a lot of folks in Vermont receive. There is a lot of harm that was passed in this bill, and there are some things that we know will happen. We can predict what will change. We can predict the harm. There are also other things we just can't predict. So we are all in this room and across the state, and advocates in other states are working in real time to understand these changes and what the true impact will be. But I think what we can really hold close and center for ourselves is that Vermont does have the resources in place to implement policy that move us toward food security for all. And Vermont has a long legacy of being champions of food security policy and passing really bold, innovative policy. And we really need to press our state lawmakers to step into leadership again in this really difficult time to reduce the harm. I also think as community service providers, folks working on the ground in community with folks tapping into SNAP or eligible for SNAP, is understanding the work reporting rules in particular. Hunger Free Vermont is offering a training on how service providers can support folks in navigating that complex role, because we do actually have an opportunity to prevent the greatest harm through one form that service providers can fill out, but there is not a lot of information about the fact that we can actually do that to support Vermonters. Again, training on supporting SNAP navigation, both in, we were talking about outreach earlier this morning. Outreach about this program is hugely important, and we all can work to both dispel myths and misconceptions about this program and really center the fact that it supports 65,000 Vermonters in getting the food they need every month. It also supports our state economy as a whole by keeping $12 million of federal dollars in our state every month, which supports our grocery stores, our farmers, and our economy more broadly. And then finally, sharing factual information. Again, there are some things we know, there are some things we don't know, and we cannot be pushing out information that is on unsteady ground, that is perpetuating fear or confusion. So as a state, really unifying our messaging and making sure we are providing folks with the resources and access points to get the information they need.
Thank you, Ivy. And the other thing the network is obviously concerned about is the potential Medicaid cuts that are coming down, but we didn't have an Ivy that we could pull a neat slide from, so we are waiting to, at future meetings, as I'm sure all of us are, look at what those potential impacts are to families' budgets and health. So going forward, what is our call to action and our goals? Reflecting on the words of Chef Jose Andres of the World Central Kitchen, if we continue to do things the way we're doing them and continue to fund things the way we're funding them, what we will have in 100 years is the same problems. Spoiler alert, I'm not sure that any of us will be here in 100 years, but we don't even want the same problems in 5 years, right? So let's not be afraid to be creative, innovative, and adjust to traditional systems and if needed funding to create solutions. Continue to advocate and endorse Vermont Food Security Roadmap 2035 and the Hunger Free Vermont's campaign to end childhood hunger. So two important strategic statewide plans. To talk to our legislators, both at the state and federal level, as Ivy was already saying. Basic needs access is a human right, and it's actually the building block, as we know, to population health. So what's our call to action? Well, tell 10 people the information you know and have them tell 10 others, because it's about community awareness. Do people really understand what is happening if they're not in it like the rest of us day to day? Do what we can as individuals. Is it buy 1 can of food a week to donate? Is it volunteer? Is it simply just to talk to others? Buy a wish list item at the various organizations like the Samaritan House. You know, it will be in the PowerPoint that's shared, so please, you can share it through your social media. Please get the word out so the folks over there can have what they need for our fellow citizens. Do drives. And again, remember that monetary donations can go further sometimes than if we buy goods for food shelves, as the buying power of the Vermont Food Bank is greater than anything that any of us can do. And the other thing that we really have to do is remember that hunger and homelessness knows no age limit. Infants up through, we're hearing medically, elderly folks that have medical challenges are unhoused. So it really is a lot. Share with the household you all work with the strategy. We call it the John Gorton strategy at the Food Security Network. If you need to use a food shelf and you have WIC and you have SNAP, at the beginning of the month, visit the food shelf first. Sometimes folks traditionally have waited to the end of the month after WIC and SNAP have gone. Go to the food shelf first, see what you can get, because again, it varies week to week as to what's available. Then supplement your food shelf groceries with SNAP and WIC. So in this way, hopefully more square meals can be prepared. So again, a great strategy that John's been telling everyone, so good work, John. The next slide I'm going to try to get through. I've already shared it with Ivy and Christine and the person who inspired the slide, so you'll see when I get to it why it might bring some tears to my eyes. I was in a conversation with one of the folks and we were emailing back and forth about some things, and he really pointed out how we really need to work with community on treating everyone with kindness. So additionally, we all need to do what we can to help the community culture. And thinking about this, let's reflect on our late leader, Robert Ostermeyer. Robert never met a homeless person, nor a hungry person, nor a stranger. Robert always met a new friend. His wisdom shows that people are just that. They're people. No labels needed. When thinking about my email exchange with our fellow community partner, this is the only way I could think to get it across. And this slide, which I know will go out to many people, and thanks to our local TV station will be on TV, is we really need to think about that. We don't go around saying, oh, I'm a housed person, I'm a person. So we need to really think about how we're treating others and reflect that kindness and work with fellow community members to be understanding and compassionate. Sorry, see I brought a few more people to tears here too. He was also known to say, Christine reminded me of this, there should not be a difference between consumer groceries versus charitable groceries that people acquire and eat. Food simply is that, it's food. So, great wisdom of Robert. And we also have to do what is often overlooked. We all have to take care of ourselves as we do this hard work, because it is emotionally draining. Finally, thoughts as we continue this journey to support our community. The members of the Food Security Network of Franklin and Grand Isle are strong individually and we're stronger together. We banded together with weekly meetings to support this region through a worldwide pandemic. We will continue to adapt, innovate, and be creative, support this region in the best extent possible during this economically challenged economy with a continued growing need. We will work to continue this marathon together because, as Ivy said, just like the partnership, it's a group of organizations that are there for one another, and we support each other, and we know each other's just a phone call away. So go Team Food Security Network. Thanks for attending and your support. Are there any questions?
Thank you, Michelle.
Yeah.
Thank you. Fantastic presentation. You did make me cry. Yay. Any questions? We have a few minutes for that. In the room or online? Check for
For those of you who are new to the partnership, Robert Ostermeyer was a driver of the Hunger Council back years ago, and he was a mentor. He was a mentor to me. In my work, I'm a nuclear submarine officer who's turned into social worker. In good part thanks to Robert and his work. I know he was a mentor to Jess Graff and others. He was at Community Action here in Northwest Family Foods and was a mentor to them. And in fact, it was actually Robert Ostermeyer's idea when we had what was called the Promise Community Grant. And we had some money to spend between Sheldon and Swanton and St. Albans. And we were trying to figure out things to do. And I had been talking about this idea of building a food shelf building. And Robert was the one who said, let's take some of this grant money and buy a walk-in freezer and a walk-in cooler for that building. And that was what kind of pushed me over the edge, that I had to build a building once I had a cooler and a freezer, I had to build a building. So Robert has, he's been an inspiration to all of us in the food security network area, and
beyond.
and beyond. Was a person sadly missed. One of the kind of neat thing, my food shelf sits there in Sheldon, and even though we're surrounded by, lots of big farms that have have farm workers, we typically did not see any migrant farm workers, coming to our food shelf. One of the issues is we really struggle. We can only get our hands on the food we can get our hands on. So getting culturally appropriate foods for somebody that's Mexican is very difficult for us. But starting about 2 months ago now, 2.5 months ago, a neighbor lady brought in a farm worker, one of the farm workers from Magnum Brothers, the big Magnum Brothers farm there in Fairfield. And she brought her twice, and after the second time she brought her, then the next time she started coming by herself. She comes now on a regular basis. And she brought her partner with her. She brings her partner with her, started bringing her partner with her. And the first couple times he wouldn't come into the shelf, but now he comes into the shelf, he comes up, gives us a hug. And starting 2 or 3 months ago, starting 2 or 3 weeks ago, she brought another migrant farmer friend, and then they brought another one. So I now have 3 migrant farmer families that are coming to my food shelf that we have, that we had never had before. And they always come in with a big smile on their face. And so I've got to figure out how to speak Spanish because I can't speak Spanish.
Google Translate.
Google Translate. Yeah. Which works well, but we really enjoy seeing them. And we had a grant. She mentioned Notch, and we had a grant coordinating with the Notch to provide foods for, because one of the other issues that we have is someone who has chronic health conditions like heart, they low sodium, they need special dietary things that we oftentimes have a hard time getting hold of. So we applied for a grant and we won a grant with Bi-State working with Notch, and we had 30 families. You had 30 people that they had identified, mostly with heart conditions. And we would use this grant money to buy food, and then the Notch prepared, working with the CSA program that Christine and Healthy Roots does. We would buy foods. The Notch would put together some recipes for how to use those foods, and then they distributed along with the CSAs that Healthy Roots was distributing, would distribute those to people. And that program ended in June, was the end of that grant money. But we got a lot of feedback, a lot of good feedback from people about, they didn't realize how to use some of the good recipes, and really encouraging them how to use appropriate food, foods appropriate for their health conditions, and how to eat better. And you don't know for sure whether you really created any, permanent change in people's eating habits or not. But it was very satisfying. It was a very satisfying program. I wish we could do more. But trying to teach people this idea of, she mentioned this idea of people, so many times we see it, and I think other food shelves see it too. The beginning of the month, everybody, they've got their WIC card, they've got their SNAP cards, they got their EBT cards, and they go and buy what they want to buy. And then when those cards run out, then all of a sudden they have to come to the food shelf. And we just keep preaching people, come to the food shelf and get what you can get, because I'm limited in what I have my hands on. Then go use your EBT cards to buy what you need to fill in and make better meals. And that's an ongoing. And I've been still looking for a grant. We had a couple of opportunities that we missed, but still looking for a grant opportunity to run some kind of a program in coordination with the Department of Health people, the Department of Health and Healthy Roots, about having some training programs, some incentives to kind of get people into that mode of understanding how to do that, how to maximize those benefits. And it's going to become, more important as we're moving ahead.
Super.
Especially you need to teach them how to use blueberries. And I think apples too. I think apples are going to create. I mean, I just got like 40 cases of frozen sliced apples. Those must be from last year because they can't be from this year. Yeah, but yeah, everybody I'm talking to, I mean, I have 2 apple trees and they're just loaded. They're peach apples and they're ripening right now and they're falling off every day. It's like bucket loads of apples. And I just talked to Doug Grant, who has apples out on the Pond Road, Sheldon Woods Road there, and he said Sunday night, he said they've got like bumper crop. So and if you look at wild apples, I think are going crazy. So yeah, I think teaching people how to use apples is going to be like a big deal this fall.
All right.
There's going to be lots of apples.
Other questions, comments?
Go ahead. I was gonna just make a plug too. We were on hiatus for this month, but Michelle, I'm thinking about Robert's quote that you had around making those connections between people and seeing folks without labels. And every other Friday, we've been having these meetings to, it started last summer, at the end of last summer, in response to, at least in St. Albans, the rise in property crime and folks making an assumption that that property crime was tied to substance use and mental illness and unhoused folks. Sometimes there's a connection, sometimes there's not, but I think we all can agree that everyone, regardless of any labels that we put on each other or ourselves, want to feel safe in our community. And certainly hunger can be a driver of choices that folks make, and we want to support a safe community where everyone is supported. So we're, again, on hiatus for August, but we're meeting again the first, and we're gonna go, actually, we're switching to once a month. So the first Friday of every month, we're going to meet at noon, all online. It's an informal group, but anyone who's interested in that, feel free to send me an email. I can get you on the invite. We're looking for ways to bridge the connection between the great conversations we have here in meetings like this and with the community, and foster ways that folks can give back. We had a volunteering fair. Melinda and Brad hosted a mini summit of the amazing summit that they just had last week. We're looking for more opportunities. Jess and I have been talking in the past, she's not on right now, but about doing coffee talks, and this would be a great presentation, I'm thinking, for one of those community coffee talks. So yeah, more to come on that, but I mean, many of the folks that are in this meeting already know about that meeting, but I figured I'd make the plug anyways, so thanks.
Super.
I just had a question. Michelle, you talked about that Notch has a thrift shop.
Yes.
How do we access that? I can't tell you how many people in the year that I've been at Holy Trinity that we have had come in saying, we need clothes. And I didn't know about this.
So I can get that information.
Okay.
It's in one of the PowerPoints that Miranda had shared. Miranda Henry, who works with the Notch, and Richford had shared a PowerPoint, and one of the food security networks, and the contact information is in there. So
perfect.
We will get that.
Great,
Can you send it to us to put in our?
Of course.
Our Highgate, our partner church, Highgate Methodist Church, also has a thrift shop where they sell stuff really cheaply, and if somebody comes in and can't pay,
That's the Memorial Methodist in Swanton has one as well. And so we send them to that, but yeah, sometimes when they come to our office, they need it like yesterday.
However, underwear is available.
But men's underwear, we
men's
know
underwear,
is available.
if they need men's underwear.
Yep.
Excellent. Thank you, Michelle.
That's another that idea of, we see the same in the food shop. Somebody will call me and they'll call me at 4:30 in the afternoon and they'll say, wow, I don't have anything to feed my family tonight. And it's like, well, okay, maybe I can run down and meet you at the food shop, or maybe I'm out in the field stacking around bales.
Yeah.
But trying to get people, when you talk about food, trying to get people to think about, okay, I know I'm going to run out of, don't wait until your cupboard is empty before you access a food shelf.
Yeah.
You know you're going to be running short of food. Well, we're open 4 days a week. Northwest Family Food, the different food shelves are open different times and different days. Go access a food shelf before you run out of food. Because that can be a heartbreaker when
I mean, like everyone though. I mean, I'll struggle to get to the.
Oh yeah, yeah.
And one thing, there was just an article in the St. Albans Messenger about changes to the SNAP program, and then one thing that they really talk about is transportation as like a catalyst for why there's so many issues. So like it's one of those things like again, I think being flexible and having volunteers, but also just like distributing resources. You know, for someone who like, unfortunately, like I have a roof over my head, like I know I can go to the store and get lunch or get the groceries I need. It's overwhelming the amount of resources and information there is. So, you know, I'm happy to help, like if there's like, I don't know, like a pamphlet or a brochure, but again, finding ways to distribute the information is super important, you know, whether it's online, whether it's putting the info in your food, like in food shelves in churches, getting like messages on the radio. You know, again, I think like finding ways to just continuously talk about these programs is important. You know, I can say like, you know, embarrassing enough, I didn't know what SNAP is, and some of the comments that I hear a lot about, you know, reasons for why maybe legislators are looking to make cuts. So it's like, well, my kid doesn't need, you know, free lunch. Like, what is this cut? But then when you hear these numbers and, you know, the data that you guys shared, and thank you for sharing that, it's alarming. And if you think about it, like Maslow's hierarchy of needs, like it's really hard to think when you're overwhelmed, and if you're struggling with hunger, you're struggling in a lot of other areas. You know, there's those co-occurring things. So, you know, for us, like I would say, like, for this group, like what can we do immediately? Share this YouTube link of the meeting, you know, on your personal pages, on your organization pages. There's a lot of really great data. And then just like keeping everyone in the loop of, you know, what's going on. And I think a lot of people can resonate with numbers to see the impacts and to know like how successful people are. And we talk about this a lot in our NCSS director meetings, is like, do we want to throw money at programs that aren't working? You know, probably not. So talk about those successes of, you know, the amount of people that we're reaching with these resources. And, you know, I not to keep like throwing plugs at the Abenaki Nations of Missisquoi, but if you go to their community page, they are always posting pictures about their food, about like what's there, like, hey, this is outside. And I just think that's like, you know, it's just like reoccurring. So I would say for anyone who does have, you know, food and resources, like create a small little Facebook page and keep posting photos. And it, I don't know, I feel like that's been really successful for you guys, and it's a regular thing that I see. Sorry.
No worries. I just wanted, there was 2 points that you made that I figured I'd make additional plugs for.
Yeah.
So our local accountable community for health, the CARES ACH, one of the things that we're working on is improving referrals and having a more up-to-date referral list. So we've got a lot of great resources. Notch has a great referral list. I'm sure every one of our organizations, I know we all have different referral lists based on the questions we get. We also have Vermont 211, which has just revamped their website. It's got a map feature that is pretty great, although Sheldon Food Shelf continues to not show up for me when I look for it. We gotta talk about that. Yeah, I expanded. They've got some kinks to work out, but they're interested in working with our community to make sure that the data is as up to date as possible.
Yeah.
You don't have to wait until they reach out to you. You can get in touch with them and update your data on their website. That can be something that you can curate a map, and then you could have a QR code and share that out with people. It gives you the information, the location, and the ACH is looking at how can we, you know, either working with a new partner or working with 211, just make our community more responsive to the needs and make sure that data is up to date and relevant for people and accessible. The other piece is transportation. So some folks may know that Green Mountain Transit is exiting Franklin County, and rural community transportation is going to be moving in. They're from the Lamoille County area in the Northeast Kingdom. That's going to be more in place within a year from now. The great thing is that we have a new opportunity with a new partner. Not that GMT wasn't a good partner, it's just they are more focused on Chittenden County right now and an urban transit need. And we have a rural transit partner that's coming in that we can do great work with. And Amy Brewer, working with many community partners as well as Northwest Regional Planning Commission. Northwest Regional Planning Commission got a grant to do a more impactful study on the transit needs from employers for their employees. Because if we know that the various industrial parks or larger manufacturers or food producers have specific shifts where more people need transit, it can help us better create a map with our regional rural community transit and other partners to improve our transit situation. So there's some, as things do, kind of slow moving, but some exciting areas that folks in our community are working on improving these access needs that we've identified through our community health needs assessments. So, please feel free if you're interested in either the work of the Accountable Community for Health, you can get in touch with me or Jess Frost at the hospital, or Amy Brewer or myself if you're interested in the transit conversation, and I can help connect you with those. But some good stuff happening right now. That's awesome.
Excellent.
You do have to be careful when you Google Sheldon Methodist Church food shelf, because there are 5 of them around the country. And about 3 years ago, I got a call from a lady in Missouri. She was looking for the Sheldon Methodist Church food shelf in Sheldon, Missouri, and she somehow got hold of my phone number.
So I want to thank you very much. Thank you, Michelle and Ivy, for a fantastic
Yes.
presentation and fantastic conversation. I feel like we've sort of naturally from the transportation moved into any kind of announcements. We have about 3 or 4 minutes if you have announcements that need to get in there. But I do have one comment about food is, as a person who is a social worker and been in this field for like 30 years, my kids were WIC kids. And so, when I think about folks, I don't think, I think about, everyone can be hungry. So.
Yeah. And as I was a WIC kid, so appreciate that. So yeah, August 16th, some people may know it in the state is Bennington Battle Day, but it is actually also going to be the first free dental pop-up clinic at Grand Isle Elementary School or Grand Isle School, starting at 9 in the morning, and we'll go until about 2 o'clock or until we fill up all available spots. But we're going to have a dentist, Dr. John, working with hygienists to provide minimally invasive exams of teeth and dentures, and being able to apply silver diamine fluoride, which can halt tooth decay until you can get in to see a dentist. It's all free. There's no need to sign up ahead of time. It will be first come, first served ultimately, and that's on Saturday, August 16th at Grand Isle School in Grand Isle.
Thank you. Who else has announcements? Wow, it's summer, I can tell. All righty. Last things, all right. I want to thank everyone for being here and having a nice, yet another sunny day. Mostly, in the words of Joe Halpo, don't forget to have a great day on purpose.
And definitely, like we said about sharing resources, utilize the community partnership email with any sort of updates or things like that, which I believe Erin already saw that in the partnership email. And also take the time to read the emails. There's a lot of really good resources, so continue to email that, and then sharing the meeting with people. I loved all the new folks here today, and coming from again referrals, but this was awesome. Thanks again, Joe.
Thank you. All right. Welcome. End the meeting. Ta-da.